When should I be concerned about the amount or duration of bleeding during a natural miscarriage?
Hello, and welcome. Today we're addressing a sensitive topic that can be of critical importance to many people. We're going to talk about natural miscarriages, specifically focusing on when you should be concerned about the amount or duration of bleeding during such an event. Remember, this advice does not replace professional medical advice, and it is important to reach out to your healthcare provider with any concerns.
What is a natural miscarriage?
A natural miscarriage, also known as spontaneous abortion, is a process where a pregnancy ends on its own within the first 20 weeks. One of the common signs of a miscarriage is vaginal bleeding, which can vary from light spotting to heavy bleeding.
What is normal bleeding in a miscarriage?
The bleeding from a miscarriage is typically heavier than a regular period, and it may be accompanied by clots or tissue passing. This bleeding often starts as light spotting, then progresses to heavier bleeding. In most cases, this bleeding will gradually decrease and stop within 2 weeks.
When should I be concerned?
You should seek immediate medical attention if you experience any of the following. 1. Bleeding that soaks through more than 2 pads an hour for more than 2 hours. This could be a sign of heavy bleeding, hemorrhage, which can lead to serious complications. 2. Passing blood clots or grayish tissue. This may be a sign of an incomplete miscarriage, where some of the pregnancy tissue remains in the uterus. 3. Bleeding that continues heavily for more than 2 weeks. Prolonged heavy bleeding could be a sign of complications such as retained products of conception or infection. 4. Severe pain or cramping, which may be a sign of complications such as a ruptured ectopic pregnancy, especially if accompanied by other symptoms such as dizziness or fainting. 5. Signs of infection such as fever, chills, or foul-smelling vaginal discharge. Infection can occur if some pregnancy tissue remains in the uterus after a miscarriage. Dealing with a miscarriage is emotionally and physically challenging. Understanding when to be concerned about bleeding during this process can help ensure your health and safety. If you experience any of the symptoms mentioned, please contact your healthcare provider immediately. Remember, it's always better to err on the side of caution when it comes to your health. Your well-being matters, and it's crucial to reach out for help when you need it. We hope this video has been informative and helpful during this difficult time.